Professor, we're now more than 4 months into this pandemic. Why do you think health authorities globally, not just in Australia but around the world, were so slow to recommend something as simple as wearing a mask to mitigate the impact of this virus?
Well, the evidence on masks has changed and evolved during the process of the epidemic. So initially, it wasn't felt that the evidence pointed to masks being very effective in preventing people from transmitting the virus to others, and that the strategy was to reserve masks for use by healthcare personnel, who were the people who most needed them. But then, since then, as knowledge about the behaviour of the virus and how it's transmitted has become greater, it's become clear that masks can contribute to some extent to the overall reduction in transmission, and hence the change in recommendations. So really, it just relates to how our knowledge of the virus is evolving.
I know you're also very closely following the global race for a vaccine. In your professional opinion, who and where is showing the best progress at the moment on that goal?
Well, there are people all over the world working on a vaccine. There were around 100 groups, and a number of those have moved into clinical trials. Results on most of those are not yet known, but certainly there's a lot of good work happening in Australia, the United Kingdom, the United States, China, other parts of continental Europe. And I think it's hard to say now. And also, of course, all of those efforts are global. So many of those collaborations involve partners from a range of different countries. And that's really how science works these days. It's particularly when we're dealing with the big challenges like pandemic diseases. These are global collaborations, and I'm confident that these collaborations will result in multiple successful vaccine candidates.
How far, though, are we away from a vaccine? Is it still something like a year or 18 months away, do you think?
Yes, absolutely. I mean, we've gone through testing processes for vaccines at an unprecedented rate. This will be the quickest, I think, turnaround from a discovery to a rollout that we've probably ever seen in terms of a major global vaccine. But even with that incredible global effort and the speeding up wherever possible of the process, I still think that we'd be looking at another 18 months to 2 years before global rollout of a vaccine or vaccines.